Welcome to Realizing Resilience, a podcast from the Connecticut Women's Consortium. We're not behavioral health professionals, but we're your gateway to real conversations with the experts. Each episode, we'll delve into the vast landscape of mental health from personal stories to expert insights. Together, we'll bridge the gap between clinical expertise and personal experiences, connecting with diverse voices and perspectives. Join us for insightful conversations that demystify the world of mental health.
Summer Krause is a licensed professional counselor, certified drug and alcohol counselor, and clinical trauma professional, with a clinical practice in Oregon that includes adolescent and adult seeking safety in both individual and group modality. Her specialties are trauma and addiction. After volunteering in juvenile detention centers starting in 1996, Summer went to graduate school to help address some of the underlying issues that contribute to youth entering the juvenile justice system. She completed her master's degree in counseling with a focus on children and adolescents and a specialized training in trauma-informed care. She has worked in nonprofit, group home, juvenile justice, residential, and outpatient settings. After being trained by Lisa Najovitz in Seeking Safety, Summer implemented Seeking Safety groups for adolescent boys and girls in a residential treatment program. She has worked with Treatment Innovation since 2011 and is a senior trainer, as well as the author of Seeking Safety Adolescent Toolkit 2023 and co-author of the Christian Faith-Based Guide to Seeking Safety 2001. She is based in Portland, Oregon. Welcome back to Realizing Resilience. I'm Marisa.
And I'm Alana.
And today we have the pleasure of speaking with Summer Krause of Treatment Innovations. Summer, thank you so much for talking with us today.
Glad to be here.
So to kick it off, for those who are unfamiliar, can you explain what Seeking Safety is and what sets it apart from other trauma treatment models?
Sure. So Seeking Safety is an evidence-based treatment that is for both trauma and addiction that was developed in the early 90s by Dr. Lisa Najovitz, who has done a tremendous amount of work in both the trauma and addiction field. And really what sets it apart is that it is a present-focused approach to trauma work. You do not have to tell your trauma story in order to benefit from this model. It is really aimed at helping people to make today and tomorrow better than the past by focusing on coping skills that they can use today to manage kind of the leakage of trauma from their past. It is the only model that has outperformed a control group in regard to both PTSD and a substance use disorder, is highly flexible. The studies that have been done on it, there have been over 60 outcome studies that have been done on this model. They've been very diverse in nature. It's been translated into 16 different languages, used on almost every continent of the globe. And what we generally see in the field is that we have lots of great models for treating post-traumatic stress disorder. We have lots of great models for working with people around substance use disorders. This model is really designed to treat the intersection between the two.
It's simpler than it seems.
Yeah.
In a good way.
Yes.
So you've been working with adolescents and with youth populations since the 90s and have been using Seeking Safety with them since the early 2000s. What introduced you to the model? How did you get into it? And how has it shaped your work?
Sure. Well, actually, I started out as a chaplain within juvenile detention centers. I did chaplaincy work in both Portland and Seattle and really love that population. But what I was struck by in working with the youth is just story after story of trauma and just the most extreme forms. And yet, working within a system where there was very much a focus on kind of their criminal acting out, and this underlying really woundedness among the youth wasn't really being addressed. And so that's what prompted me to go to graduate school, was to really help address that trauma-related theme among youth. When I graduated, I started working in a program which was all for youth who were in state custody, on probation or parole, who had issues with mental health, substance abuse, criminal behavior. And that's when I was introduced to Seeking Safety. One of the very first things that I learned when I came into the field with a desire to specialize in trauma is that if I was going to specialize in trauma, I was going to need to specialize in addiction, because so often these two things go hand in hand. So while working in this program, there was someone who really knew what had drawn me to the field in the first place. And she said, Have you heard about seeking safety? And at this time, really, the model hadn't been out very long, and I was super interested to learn more about it. I remember going onto the website to find out when's the next training. And back then, there weren't any convenient webinar options, but the next conference that Dr. Najovitz was teaching was in British Columbia. So I just headed on a road trip, asked my husband if he was up for it, and we drove to BC to hear Dr. Najovitz give a training and presentation and really just fell in love with it. Came back, started implementing individual and group sessions with the youth, and just found it to be so effective even though I was working with a very difficult to serve population, so I knew that I was going to have to kind of develop a bag of tricks in terms of how to engage them in the process. Most of our youth had major trauma histories. All of them struggled with substance abuse. And so I started facilitating these sessions, but also kind of incorporating things like games and elements of art and different kind of creative things into the sessions. I ended up reaching out to the author, and we did a couple of different consultations together. And then I shared with her some of what I was doing with the youth, and we formed a partnership. We've been working together for a very long time. And for me, doing trainings like the one that's coming up, doing consultations with different organizations, and then I developed what's called the Seeking Safety Adolescent Toolkit, which is basically a supplement to the treatment for adolescent providers that's based on just years of implementing this model with adolescents, but now also working with lots of different adolescent providers, hearing their feedback and things that they're doing as well. So that just came out in 23, and that was a project that I started working on when I was pregnant with my daughter. And then by the time it actually came out, she was in high school herself. So it was the never ending project, but it is out and available to use. And what I've been really surprised by is that a lot of adult providers are using it as well, with, above and beyond just working with teens. So I developed that toolkit, and then I also co-authored a faith-based guide to seeking safety as well for specific populations to incorporate specifically Christian faith into the work as well.
I think that's a great testament to the efficacy if you've been working on it for that long and
Yes,
you're still going strong on it, then something's got to be going right.
that's right. I still love it.
Yeah, that's awesome. I really admire juvenile justice work. We were just talking to someone about adolescent psych, so I feel like I say this on almost every podcast, but it's just really exciting when people are doing work with youth to get to the root cause of the trauma, because I used to teach and I just cannot stand the punitive lens that a lot of people look at kids through. So it's just very exciting that there's so much of this work.
Yes, things have come a long way. And it's more effective at the end of the day as well. And most of the youth are going to return to the community. So it's not only good for them, but it's also good for the community at large when we really get to the heart of things.
I also like hearing whenever we do these podcasts or we talk with trainers, I love hearing people's non-linear journeys to get to where they are. Like, I did not expect you to say you started as a chaplain. And I love that. I love just hearing that, oh, this person was in a completely different direction and now here they are, and listen to how they got there.
It is a journey. Things evolve.
So a lot of clinicians want trauma-informed tools, but they feel overwhelmed by a lot of the complex models. How is seeking safety different than that in terms of ease of implementation?
Yeah, seeking safety is lovely in that it is such a structured model that has this kind of predictable rhythm to it. People who facilitate it very quickly adapt and adjust to kind of the structure of the sessions. And I'll add that clients also become very accustomed to the rhythm of seeking safety. Just as you said, there are lots of great models that are out there, but sometimes they assume like a highly credentialed workforce, and they require a lot of hoops that you need to jump through in order to use them, which in some cases really makes it difficult for them to ever kind of get off of the ground. Seeking safety actually does not require any particular degree, training, certification in order to implement it. So the only thing that people must have is the book. And one book goes a long way because there's both a detailed guide for the facilitator and then reproducible handouts that people can just photocopy from the book and use with their own clients. Now, the copyright will outline that every facilitator needs to have their own copy of the book, but you can reproduce the handouts as much as you would like in order to use them with clients. So, this is a theme based model. We have 25 topics that they can choose from. And usually it doesn't take very many sessions of people doing it before they become comfortable. I use other models as well, and some of them, they're great. We know them to be effective, but I had to do them for several months before I really felt like I had a handle on it and was comfortable doing it. Seeking safety just is not that way. And in fact, in some of the studies that have been done, it's been shown to be, a model that has very high provider adoption rates. It's been shown to be sustainable within organizations over time. And for every one of the topics that make up seeking safety, there are tips for the facilitator and quotes from clients of challenging things they've said to be able to kind of prepare for some of those tough cases, discussion questions that you can pull from. So it is a model that really is something people can get started with right after the training.
So when people come to your training on July 9th for Seeking Safety, what will participants be able to walk away with?
Sure. So if you come to the training, you will be able to leave the training and immediately get started using it. The only thing that you'll need is just to have your own copy of the book. The training is really interactive, so you'll have an opportunity to try out a number of different exercises from the treatment model and be able to apply it to your own life as well. Seeking safety is not just something I teach and use with my clients, but I try to live it in my own life as well. So we'll do a number of things with the skills from seeking safety. And some examples of tools you'll leave with would be a list of 84 safe coping skills that are just very versatile that you can use with a wide variety of different clients. We'll do some exercises related to detaching from emotional pain, kind of grounding skills. We're going to do a checklist related to self care that you can take yourself, but of course also use with the folks that you serve. And you will be able to not only learn about the model, but also see it be conducted. And you're going to have a chance to try it out on your own as well. So you will leave with a greater understanding of seeking safety, but also this intersection between trauma and addiction. You do not have to use the model exclusively with people who have both. You can certainly use it with folks who maybe have just one or the other, or maybe neither. So, really, anyone who could benefit from coping skills can benefit from seeking safety as well. But this is a model that you can use with the folks that you serve as part of integrated care.
I guess a further question that comes up for me after hearing you say that, there are kind of the 25 modules built in, but is it like you have to do a certain amount of them and then it becomes seeking safety? Or is it like piecing it with maybe other things like you're still doing the model? Does that make sense?
Yes, great question. So there are 25 topics to choose from, but you can kind of think about it as like a menu of options. So even in the studies that have been done that have had, very good outcomes, they haven't always done all 25 of the topics. So in some settings, people just have a very small handful of sessions to do, and that's fine. They can get something out of those. In other settings, maybe like a day treatment or residential program where there may be sessions every single day, or they're working with people over a much longer period of time, sometimes the 25 topics get broken up and spread out into more than 25 sessions. So you have a lot of flexibility and every topic stands alone. So you don't have to do them in order. You can prioritize topics that maybe seem like they would be most relevant for that client.
And so if after this training people feel like they maybe want more clinical practice or like experiential practice with a trainer before they put it into practice with their clients, what resources do they have to keep following up and keep learning?
Sure. There's actually a wealth of information on the website, which is seekingsafety.org, or treatment-innovations.org. They're actually both the same website, either thing people enter in. And there's a library with over 100 articles related to trauma and addiction, a really nice section on frequently asked questions, a variety of different podcasts or other sort of videos related to the models. So there's a lot available for people on the website. And there's also the option for consultation if people are interested in that, to have, either a small group or one-on-one to be able to receive further guidance from someone like me.
I love that even with you just giving a general overview and talking about it, it's easily digestible.
Right.
There are sometimes we have people on the podcast where they're speaking about models or treatment plans that I'm actively trying to use every one of my brain cells to figure out how this would work in the setting or just explain what it is, having, no prior knowledge.
Right.
So I like that even someone like me who doesn't have any behavioral health education is understanding what this whole model is about.
Yes. And I would add to that, you could conduct it even without, specialized training in terms of the behavioral health field. That this is a model that even the studies that have been conducted like peer to peer or by other non-clinical roles as well. So it really helps improve access to care when we are able to have it be safely conducted by a wide variety of different roles.
And I have to imagine too that makes people have a little bit more buy-in to their own care if it feels like this thing that is accessible equally and not super academic and something that's being done to them, but something they're doing with you, I imagine is pretty effective.
Yes. And Dr. Najovitz really has a gift in terms of how she writes. I mean, she uses language that really kind of helps to build hope and optimism, which often get lost as a result of trauma and or addiction. And so she tries to write these handouts in a way that is easy to understand and uses words like safety and respect and honesty, commitment, compassion, really all throughout.
I appreciate you taking the time to break this down for us and for everyone who's listening, because I am also someone who saw the word seeking safety and didn't know 100% what that was about. That could mean so many different things. So I really appreciate you taking the time to kind of break it down in a digestible way for us.
Sure, glad to.
Thank you so much. We are looking forward to that training. It's coming up. July is so soon.
I know.
That's right. Yes, next month.
Links will be in the description to sign up for Seeking Safety on July 9th and to learn more about treatment innovations and their work. You can also visit Seeking Safety's website that Summer mentioned at the link in the description. Check out our links below to keep up with us at the Connecticut Women's Consortium. Thank you for tuning in today, and we'll see you next time.